Imagine this. You're rushing to the hospital. The air is thick with tension and your heart is pounding. Every second feels like an eternity as you hope and pray for the best. Someone you love is sick. The waiting room is filled with anxious faces, each one carrying a story of worry and hope. You can feel the collective anxiety in the air. Suddenly you get a huge bill. The numbers seem surreal, almost like a bad dream. You wonder how something so essential can come with such a hefty price tag. That's scary for anyone in the Philippines. The bustling streets are filled with people who share the same fear: how to afford healthcare without going broke. No one wants to choose between being healthy and having money. It's a heartbreaking dilemma that many face, forcing them to make impossible choices. Sadly, this happens a lot. Families gather, discussing how to pool their resources, often coming up short. The stress of financial strain adds to the emotional burden. Medical emergencies pop up when you least expect them. They strike without warning, leaving you scrambling to find a solution in the midst of chaos. They can cost a lot of money. The bills pile up quickly, each one a reminder of the financial burden that comes with medical care. Without health insurance, you could lose all your savings. The safety net you thought you had can disappear in an instant, leaving you vulnerable. You might even end up owing money. Debt collectors become a constant presence, adding to the stress and anxiety of an already difficult situation. It's crucial to explore health insurance options. Understanding your choices can make a significant difference in how you handle medical emergencies. Health insurance can provide a safety net. It helps cover the costs, giving you peace of mind and allowing you to focus on recovery rather than finances. Imagine the relief of knowing you're covered. The peace of mind that comes with health insurance is invaluable, allowing you to care for your loved ones without the added stress of financial ruin. Community health programs can also be a great resource. They offer support and information, helping you navigate the complexities of healthcare. Remember, healthcare is a right, not a privilege. Everyone deserves access to medical care without the fear of financial devastation. Let's work towards a future where no one has to choose between health and financial stability. Together, we can make a difference. Health insurance is like a safety net. It protects you from big medical bills. When you have health insurance, you don't have to worry as much. You know you can get the treatment you need without going broke. In the Philippines, we have two main types of health insurance: PhilHealth and HMOs. Let's learn about both. PhilHealth is like the national health insurance. It was established to provide health insurance coverage to all Filipinos, ensuring that everyone has access to affordable healthcare services. The program is designed to help reduce the financial burden of medical expenses on individuals and families. If you have a job, you have to have PhilHealth. Employers are required by law to enroll their employees in the program and contribute to the premiums. This ensures that working individuals have health coverage and can access medical services when needed. The contributions are shared between the employer and the employee, making it a joint effort to secure health benefits. But even if you don't have a job, you can still get it. PhilHealth offers various membership categories, including those for self-employed individuals, overseas Filipino workers, and even indigent members who are sponsored by the government. This inclusivity ensures that everyone, regardless of their employment status, has the opportunity to be covered by health insurance. PhilHealth helps pay for some things like staying in the hospital, seeing a doctor, and having a baby. It covers a wide range of medical services, including inpatient care, outpatient consultations, and even certain surgical procedures. For mothers, PhilHealth provides maternity benefits, which cover prenatal care, delivery, and postnatal care, ensuring that both mother and child receive the necessary medical attention. But PhilHealth doesn't pay for everything. While it significantly reduces the cost of medical services, there are still some expenses that members need to shoulder. These can include certain medications, specialized treatments, and other out-of-pocket costs that are not fully covered by the insurance. It might not pay for all of your treatment. Depending on the severity and type of illness, the coverage might only partially cover the total cost. This is why it's important for members to understand the extent of their benefits and plan accordingly for any additional expenses that might arise during their treatment. You might also have to wait a long time at public hospitals. Due to the high demand for medical services and the limited resources available, public hospitals often experience long queues and crowded waiting rooms. This can be challenging for patients who need immediate medical attention. However, PhilHealth is continuously working to improve the healthcare system and reduce waiting times to provide better service to its members. HMOs are private health insurance companies. They offer more than PhilHealth. HMOs usually work with lots of hospitals and doctors. With an HMO, you might not have to wait as long. You might also get extras like help paying for the dentist, glasses, and having a baby. There are different HMO plans for single people, families, and older folks. The Philippines has lots of good HMOs. Some of the best are Maxicare and Medicard. Maxicare has lots of hospitals and doctors and many different plans. Medicard is good if you don't have a lot of money and want choices. Other good HMOs are Pacific Cross, Kaiser, and Insular Healthcare. Each one has different plans. It's important to compare them before picking one. Choosing the right health insurance can be confusing. With so many options available, it's easy to feel overwhelmed. But don't worry, we're here to help you navigate through the process. By understanding your needs and priorities, you can make an informed decision that suits your lifestyle and budget. First, think about how much money you can spend each month. Your budget is a crucial factor in determining the type of health insurance plan you can afford. Take a close look at your monthly income and expenses. How much can you realistically allocate towards health insurance without straining your finances? Remember, it's not just about the monthly premium. Consider other costs like deductibles, co-pays, and out-of-pocket maximums. Next, think about what kind of medical care you need. Are you someone who visits the doctor frequently? Or do you only go for annual checkups? Do you have any ongoing medical conditions that require regular treatment? Make a list of the medical services you use most often. This will help you identify the type of coverage you need, whether it's for routine care, specialist visits, or emergency services. Do you have any health problems already? If you have pre-existing conditions, it's important to choose a plan that covers the treatments and medications you need. Some plans may have limitations or waiting periods for pre-existing conditions, so read the fine print carefully. Knowing your medical history and future health needs can guide you in selecting a plan that provides adequate coverage. Do you take medicine regularly? Prescription drug coverage varies widely between plans. If you take medications on a regular basis, check the plan's formulary to ensure your prescriptions are covered. Some plans may require you to use generic drugs or have higher co-pays for brand-name medications. Understanding your prescription needs can help you avoid unexpected costs. How big is your family? The size of your family can significantly impact your health insurance needs. If you have a spouse and children, you'll need a plan that offers comprehensive family coverage. Consider the health needs of each family member, including routine checkups, vaccinations, and any special medical requirements. Family plans often provide better value than individual plans, so weigh your options carefully. Do you need to cover your husband, wife, or kids? Family coverage is essential if you have dependents. Look for plans that offer pediatric care, maternity benefits, and coverage for common childhood illnesses. If you or your spouse are planning to have children, make sure the plan includes maternity and newborn care. Comprehensive family coverage ensures that everyone in your household has access to the medical care they need. Finally, think about how much coverage you want. Health insurance plans come with different levels of coverage, from basic to comprehensive. Basic plans may have lower premiums but higher out-of-pocket costs, while comprehensive plans offer more extensive coverage with higher premiums. Decide what level of coverage you're comfortable with. Do you want a plan that covers almost everything, or are you okay with paying more out-of-pocket for certain services? Do you want it to pay for almost everything, or just the basics? Your choice will depend on your health needs and financial situation. If you're generally healthy and don't expect to need much medical care, a basic plan might be sufficient. However, if you have ongoing health issues or want peace of mind knowing you're covered for any eventuality, a more comprehensive plan could be the better option. Make sure to read all the details before you sign up. Health insurance policies can be complex, with many terms and conditions that affect your coverage. Take the time to read the policy documents thoroughly. Look for any exclusions, limitations, or special requirements. If you're unsure about any aspect of the policy, don't hesitate to ask questions. Understanding the details will help you avoid surprises and ensure you're getting the coverage you need. Mental health is just as important as physical health. Lately, people in the Philippines are talking more about mental health. More people are getting help for things like anxiety and depression. The good news is, some health insurance plans now help pay for mental health services. This might include talking to a therapist or psychiatrist. Some plans even help pay for mental health hospitals. Don't wait. Getting health insurance is a good idea. It helps you feel safe knowing that you and your family are protected. Talk to an insurance company today. Look at different plans. Pick the one that works best for you and your family. Your health is important, so protect it with health insurance.